Yes,
Okay.
now it has.
So, making positive moves, the living process. Okay, so what support do people with learning disabilities need to remain living in the community after they've moved out under the Transforming Care program? So, this is a qualitative longitudinal study, and the people listed on this slide are everyone who works on the project. There are also other people, but we haven't listed everyone. Our logo that you see on this slide is actually a very special one because it was created by one of our participants. So each little icon that you see on this logo presents stuff that are very close to her heart. So it's like her house, it's the key that she can lock her own house, it's her dog that was really important to her. And then it's got like people and flowers because she really likes people bringing flowers to her. So yeah. So I'll start with a bit of background. What is transforming care? And not everyone knows this, but for those who know, it's just a refresher. So back in 2011, BBC Panorama, the program exposed abuse and mistreatment of patients at Winterbourne View, which is a privately run hospital for adults with learning disabilities. And so after this, the government launched a review to investigate such hospitals, and the review revealed that there are too many people living in these inpatient services without the adequate assessment and treatment, and often these people stay in these hospitals than longer than's needed. And so after this, the government launched the Transforming Care program, and it was set up by NHS England in 2012. The aim of the Transforming Care program is to support people with learning disabilities and or autism to move from living in inpatient settings to the community. But there's a lack of evaluation which looks at the perspectives of people who have moved under the Transforming Care program. Okay, so our study started off from what was a Declan Sci project by Annabelle Head. This is the reference, so you guys can look at this at your own time, and it's freely available. So this was looking at the moving process. So the aim was to explore how people with learning disabilities experience moving on the Transforming Care program. So in that study, in the moving process study, what did people tell us? So people talked about um, being naughty and having restricted identities, and that so their identities were actually defined by aspects of their behavior and how this was seen by hospital staff. So they had like really restricted identities when they were in inpatient settings. But through transforming care, they felt that they were given a chance. And obviously, the moving process, it wasn't easy. People experienced a range of emotions. So for some, it was sadness. People felt excited, but also worried. But then being in their new homes was a chance for them to be a new person. They felt like they were more adult. They were the person they were before. They felt like they were seen and treated differently by others, and this helped them to build new identities. Okay, so the current study is the living processes study. What do we want to find out? We want to know what it is like to live in the community after moving on the transforming care, no living, yeah, and what helps people to stay living in the community in the long term, what makes it harder to stay living in the community in the long term. So we want to know what helps them and what is making it harder. So the living process study, and how are we going to find things out? We recruited around 22 people with learning disabilities who have moved from inpatient settings into the community. Now we have completed all our time one interviews. We are in the process of completing our time two interviews. Um, each of our participants were recruited from various places across England, and into yeah, we interview each participant twice. So at time one, it's twice, and at time two. So the interviews are once by themselves, and then by themselves or with a key support person. So that again depends on their choice. And each participant is interviewed again after a year. So this is for us to see what's changed. Okay. How did we support people with learning disabilities to take part? So we helped them by making sure that the participant was first approached by someone who knew them. So it could have been their care coordinator. And then we had introductory meetings. So it helped them to understand the project, and it was for us to assess their capacity. Our interviews are also very flexible, so participants can have their support there. Um, like a carer, they can bring along photos, drawings, their weekly timetables. And so we have two interviews at each time point, and one of these is with a key support person. And we use something called dyadic interviewing. And this is extended using the internalized other approach. So what this dyadic internalized other interviewing method is that we ask our key support person to put themselves into the shoes of the person, so that the participant that we're interviewing, and we ask them the questions and they answer as if they were that person with the learning disabilities. And then we again don't leave it just there. We go back to the participant and ask them if that's correct and if they agree or they would like to add more to what their key support person just said. So the Making Positive Moves project also has a expert by experience consultation group, and this is made up of people with learning disabilities. The group is chaired by Sam Prowse. We have slides which from the EECG group, which will be shared on YouTube as well, so people can access them and watch it in their own time as well.
Okay, so our next few slides are about how we plan to share the findings and sort of how we want to engage with stakeholders for the research. So people who might have an interest in the findings, but also people who may be able to use the findings in their day-to-day work or life. So we've got different ways that we're looking at sharing the findings. Obviously, top of our list there, it says collaboration, because our aim really is to work with people with learning disabilities, their families and carers, organisations supporting them, care provider kind of organisations, and that include and health and social care sort of professionals, and anyone else that might be involved in when somebody is moving out of hospital and then living in the community longer term. So our first exercise has been to map our stakeholders, and I'll talk a little bit more about a model we've used for that in a moment. We also plan to hold a national conference, and we have been holding these stakeholder conferences that this presentation was a part of, with the aim of starting that conversation with our stakeholders. And then we also plan to develop some quality standards. So we'll be targeting kind of policy, CQC and other organisations with those, producing accessible reports about the research, which will include kind of in different formats. So that might be videos, blog type articles and other accessible materials. And then writing articles about the research. And then we also have the Making Positive Moves website, and that will be a resource, continue to be a resource for people who are moving. And we will also continue to post information about the research on there through the blog. So in terms of our stakeholder mapping, we've done an exercise that's been about trying to find out who may be interested in our findings and who do we need to be sharing the findings with to have an influence over how services are delivered for people with learning disabilities when they are going through the process of moving out of hospital and living in their own homes. So we've identified a number of different groups that are all on our stakeholder wheel here. So we've got anything from the person moving in one section through to kind of policy organisations, academic community, regulators like the CQC, care providers. So there's kind of everybody on there. And our aim through starting conversations with people or sort of learning about their work is to identify whether they fit at the centre of our circle in that sort of red ring next to the project. And they're the people who are able to use the findings to influence the way support is delivered, and or for people directly with learning disabilities that may want to access our website for resources or learn about our research and how it might help them to navigate a transition or a move. And then once we've identified the people in the red circle, they will be the focus for our kind of follow on in terms of resources, mapping, conferences, presentations, anything that we produce, and will be targeted at those groups. And we hope that those groups will help us understand what they need from us. And then the amber circle is people who are interested and may be able to share resources or tell others about the findings, or so that might be organisations that have member networks that would be interested and they can circulate it. So we know how to link in with them. And then green is kind of people who are interested, but will perhaps just attend a presentation or a conference, and that would be the end of their kind of link to the research. So all of that work is designed to make sure the research has the biggest impact that it possibly can. And we've heard directly from people with learning disabilities about their experience, and we want to make sure their voices are heard elsewhere where they need to be. So, and this is the website, so www.makingpositivemoves.org. This was created out of our original research, so Annabelle's moving process research. And so the categories we developed for the website and what's within those categories was based on what people told us their experience was. So people said they needed help with their emotions. They were very up and down during the move, excited, but feeling very anxious, sometimes sad about delays, sad about leaving people in the hospital, but also excited to make new relationships. So the section looking after myself has resources to support somebody if they were going through a move with the emotional side. Practical stuff, so how do you navigate kind of moving, what are the sorts of things that you might need help with, who can help you with those things, connecting with others, which is about relationships and sort of making sure you keep positive relationships, but also stay connected to the people that were important in your life, even if you're moving across a long distance, as some of the people were that we supported. And then legal stuff, which some people might need to learn about their rights, but also if they have been in hospital linked to kind of the criminal justice system, then there might be more legal stuff for them to read about there. The website also has a blog. So just one final thing to say about the website. It has a blog, and that we use that as a place to share updates about the research. So if you do want to find anything out, there will be regular posts on there as well. And so then just to give you a bit of a sense that the conference has involved presentations by a number of different people, and the reason for that is that we have a number of projects running which are linked to the original Making Positive Moves study and our bigger grant funded research, but they're avenues that we feel aren't covered in the study and that are important pieces of the jigsaw, really, things that need to be explored so that we can have a better understanding. So we've got the study It's Not Easy Work, which was research with health and social care professional perspectives of making positive moves, and that was Kaylee. So you can see Kaylee's presentation again. That will be uploaded onto YouTube from the conference day. We've got exploring the perspectives of people with learning disabilities and complex needs through discussion with their loved ones, understanding the experience of transitioning out of hospital. So this is a project that's now running and is based on a pilot study that was done. So we hope to be able to share the findings from that pilot study, which is down there in yellow. That was Megan Stock's research. So those results should be out soon. And that is very much about capturing the perspective of people who weren't able to take part in making positive moves originally because of capacity to consent to research or the methodology being an interview that was largely based on conversation. So people who might be more nonverbal would, we have done some research to interview their family members and carers to make sure their needs, which might be different, are understood. So that's a broader project that will be continuing, but we will have the pilot results soon. And then we've got the everyday lives of adults with learning disabilities down there in pink. So in the right-hand corner, this was a project by Olivia Mitchell, and she used our original data set from Making Positive Moves, but looked at this particular angle, and Olivia's results were shared as part of the conference and are also available on the YouTube site. And obviously the little orange circle is just our original study, Making Positive Moves, the moving process. Okay, so finally, our overall aims from all of the projects that we're running is to try and improve quality of life for people with learning disabilities living in the community and reduce admission and readmission to hospital, and in particular sort of targeting length of stay, inappropriate admissions, and trying to make sure that those things don't happen in the way that they have done for some of the participants that we've spoken to. I think that is the last slide. So that is the end of our presentation today.